Hey, my name is Jason. I'm going to do my NG tube video. So the first thing I'm going to do is a knock on the door, do hand hygiene, walking in, and introduce myself. Hi, my name is Jason. I'm going to be your nurse today. I'm going to do an NG tube on you. Can you tell me your first and last name? And can you tell me your date of birth? Once the patient is verified, I'm going to ask the patient if he's ever had this procedure done before. Sir, have you ever had this done before? And he'll tell me yes or no, and then I will explain the procedure. This is called an NG tube. It's a tube that goes into your nose, down into your belly. It helps us assess your gastric contents and helps decrease the pressure in your belly if need be. And then I'm going to ask the patient, or I'm going to assess the patient's nares to make sure which side I want to go in. So I'm going to inspect it, looking up one side, looking at the other side. I'm gonna have the patient breathe in. Can you breathe in real deep? And then hold the other nair, have the patient breathe in again. Can you tell me which side is easier for you to breathe out of? All right, the patient is saying this side is easier for him to breathe out of, so we'll use that. I'm gonna need you to sit in high Fowlers, sit completely upright, just like you are right now. And I have all my stuff prepared. I have my tape ready, I have my NG tube down here, and my 60cc syringe. I also have suction canister and wall suction. So what I'm going to do is measure from the tip of the nose around the ear down to the xiphoid process. We're at between 60 and 65. So we can either mark it or just use one of the lines and use that as verification. I'm going to take water-based jelly and lube about 4 inches of the tube. I'm going to have the patient hyperextend and look completely up. So I have the patient looking up just like that. I'm going to let the patient know I'm going to go insert the tube into the right nair. Sir, I'm going to put the tube into your nair. I'm going to go in, pass the mouth. As soon as I meet resistance and I'll pass the mouth, I'm going to inspect in the mouth. Sir, can you open your mouth real quick for me? Make sure it's not coiled up in there, and then that it's going down to the trachea. Down to the esophagus. And then once I'm there, I'm gonna have the patient put his chin to his chest, and then if I have somebody to give water, I'm gonna have the patient drink water while I'm feeding the tube down. So I'm gonna have the patient swallow. Keep swallowing, sir. Keep swallowing. Keep swallowing. Keep swallowing. Keep swallowing, swallow, swallow, swallow just a little bit more, perfect. And I am currently at in between 60 and 65 like I had measured. I'm gonna have the patient talk. Sir, can you say your name? Patient is able to speak, so I know I'm not in his trachea. I'm looking at the SpO2. SpO2 is still in the normal range, which we are originally at. And then I'm going to listen to make sure I'm in, or I'm going to aspirate first since I'm already, since I'm here. Aspirate to see if there's any gastric contents. There is gastric contents. Take it, test the gastric contents with my pH paper, and then pull in some air, place it back onto the NG tube. I'm going to have somebody else listen, but since I don't have a partner right now, I'm going to. Typically, I would have a partner listen for me, but I'm going to listen over the epigastric. I'm going to push air in. I got gurgling over the belly. I'm going to go ahead and tape this into position because I know it's in, and then I'm going to send them off to X-ray to verify. So I'm going to go and tape this down. I have a chevron here, taping one side around, doing the opposite direction with the other side, and then using a piece of tape over the top of the bridge just to keep it in place. And then I'm gonna have X-ray come in and shoot my X-ray to verify my placement. Once X-ray verifies placement, I'm going to do my charting, which I'm going to let them know which size tube I have. I have a Salem Slump 18 French, 65 centimeters in the right nair. Clear gastric contents, and then how the patient is feeling. Patient is not complaining of any discomfort at this time. Go ahead and chart that, and then hand hygiene and leave. the patient is, and then all of a sudden I come back, the patient is complaining of nausea. So I'm going to reassess what's going on. If I have x-ray still available, shoot another x-ray to confirm it's still in. If not, I'm going to go ahead and get my syringe, and then I'm going to try to aspirate. If there's any, if there's anything in, if I get anything in my tube, I know I'm in. But since I'm not getting anything, I'm going to try to bolus air in there. So I'm going to listen one more time over the epigastric. Taking a listen. I got gurgling over the belly, so I know I'm in. And now I'm going to perform an NG lavage. Same thing. I'm going to let the patient know, sir, I'm going to put fluid into your belly to help trying to irrigate it out, make you feel a little bit better. In doing this, I'm going to use some normal saline. I already made sure that I made sure that it's in. The patient is currently attached to wall suction, and then I'm going to verify the contents that's out of there. So I got, we'll say, 200 cc's of clear contents right now, and then I'm going to bolus 60 cc's of normal saline through the NG tube. So putting it in, I'm pushing some 60 cc's of normal saline. Swap this out to the wall suction on low intermittent. Watch the 60 cc's come back out, and note the characteristics. If it's still not clear, I'll go ahead and do it again. So pull up 60 more, place it right back into the tube. Go ahead and push 60 more back in. Swap this out to the wall suction on low intermittent suction. Watch it out, watch the characteristics until it clears up. I'm going to repeat the procedure until it is actually clear. Once it's clear, I can keep the patient on low intermittent suction and go chart the NG lavage now. So I would say the patient's NG tube was verified into the epigastric, into the belly, and then however much fluid I did, we'll say 120 cc's lavage through the NG tube, came out clear. Patient has no more discomfort, and that is it.